I want you to imagine something for a moment. You have just finished what felt like a genuinely healthy dinner. Steamed vegetables, a fresh salad, maybe some garlic in your cooking. You felt good about your choices. You went to bed feeling like you had done everything right. But somewhere in the early hours of the morning, something shifts. You wake up dizzy. One arm feels strange. Your words come out slower than your thoughts. Or perhaps you do not wake up feeling quite like yourself at all, and you cannot explain why. But here is what 25 years of working with older adults has taught me. After 60, the body processes even genuinely healthy foods differently than it did at 40. And there are 9 specific vegetables that millions of seniors eat regularly, sometimes daily, that can quietly raise stroke risk when eaten at the wrong time, in the wrong amounts, or alongside the wrong medications. I am not here to frighten you away from vegetables. I am here to give you the specific knowledge that turns a well-intentioned plate of food into something your aging body can actually work with safely. Because there is a significant difference between eating healthy and eating smart. And after 60, that difference matters more than most people realize. Stay with me until the end. The final vegetable on this list is one most seniors eat every single week, and it may be the most misunderstood of all 9. My name is Dr. Williams James. I have been practicing medicine for 25 years, with a clinical focus on the health and wellness of older adults. In that time, I have sat with more patients than I can count who were doing everything they believed was right. Eating their vegetables, taking their medications, making what felt like responsible choices, and still experiencing cardiovascular events that should not have happened. When I started looking more carefully at the patterns, diet and timing kept appearing in ways that the standard conversation about stroke prevention was not addressing. Today I want to address it directly. 9 vegetables, what they do inside the aging body, and how to keep eating them safely. Stroke is the 5th leading cause of death in the United States, and one of the leading causes of long-term disability in adults over 60. The majority of public health messaging around stroke prevention focuses on the obvious dietary villains: saturated fat, excess sodium, processed foods, alcohol. And that messaging is not wrong, but it is incomplete. What it consistently fails to address is the way the aging body responds differently to foods that are genuinely nutritious, and the way that difference becomes clinically significant when combined with the medications that most adults over 60 are already taking. After 60, kidney filtration slows. Blood vessels lose elasticity and become stiffer and more fragile. The body's thirst signals weaken, making chronic mild dehydration far more common than most seniors realize. Blood sugar regulation becomes less efficient, and the majority of adults in this age group are managing at least one chronic condition with prescription medication, many of which interact with specific compounds found in common vegetables. Research published in leading cardiovascular journals has consistently shown that stroke risk is not determined by a single dramatic dietary choice. It is shaped by patterns, timing, combinations, and the cumulative effect of daily habits on blood viscosity, blood pressure stability, and cerebral circulation. Understanding those patterns is what this conversation is about. Think of your circulatory system after 60 like a network of aging pipes carrying water through a building that has seen decades of use. The pipes are narrower than they once were. The pressure inside them is less consistently regulated. The pump working them is still doing its job, but with less reserve than it had 20 years ago. In that system, anything that causes the fluid to thicken, the pressure to swing unexpectedly, or the pipes to constrict or dilate at the wrong moment, creates risk. And the overnight hours are when that risk is highest, because during sleep, hydration is not being replenished. Blood naturally thickens slightly. Blood pressure follows its own nocturnal rhythm, and the body has no conscious awareness to notice early warning signals. What you ate for dinner is still being processed during those hours. The compounds in your evening meal are still interacting with your medications, influencing your blood pressure, affecting your blood viscosity, and either supporting or stressing your cerebral circulation while you sleep. That is the window these 9 vegetables can quietly affect, and that is why timing, quantity, and awareness matter as much as the food choice itself. The first vegetable that deserves your attention after 60 is one that has spent decades at the top of every superfood list: spinach. Spinach is genuinely rich in iron, magnesium, folate, and antioxidants, and none of that changes after 60. What changes is how the body handles one of its less discussed compounds, oxalates. These are naturally occurring substances in spinach that bind to calcium in the digestive tract. In younger adults with efficient kidney function, oxalates are filtered and excreted without significant consequence. But after 60, kidney filtration slows, and many seniors are also taking calcium or vitamin D supplements daily. When oxalates combine with supplemental calcium in a system that is filtering more slowly, tiny calcium oxalate crystals can form and accumulate in ways that affect the small vessels that feed brain tissue. Over time, repeated exposure can contribute to narrowing of those vessels, reducing the oxygen delivery that cerebral tissue depends on. The practical adjustment is straightforward. Eat spinach earlier in the day when your body is actively hydrating and your kidneys are working at their peak. Avoid pairing large amounts of spinach with calcium supplements at the same meal. And if you have existing kidney concerns, make this a specific conversation with your physician. Spinach remains one of the most nutritionally valuable foods available to older adults. The goal is not elimination, it is timing and awareness. The second vegetable is one that most people would consider the foundation of a heart-healthy diet: broccoli. Broccoli is an exceptional source of fiber, vitamin C, and antioxidants. But it is also one of the most concentrated dietary sources of vitamin K, the nutrient that regulates blood clotting. For a healthy adult not taking any medications, abundant vitamin K is a benefit. For the significant percentage of adults over 60 who are taking blood thinners such as warfarin, clopidogrel, or daily aspirin, vitamin K intake requires careful management. The danger with broccoli is not consistent consumption. It is inconsistent consumption. Eating large amounts one week and very little the next creates unpredictable swings in how effectively blood-thinning medications work. Blood that is insufficiently thinned can clot too easily inside already narrowed vessels. Blood that is over-thinned carries its own serious risk of hemorrhagic events. The solution is consistency, not elimination. Eat broccoli regularly in moderate amounts and keep that amount stable week to week. And critically, tell your physician what your typical weekly vegetable intake looks like so that medication dosing can be calibrated accurately around it. The third vegetable surprises most people because it seems so light and benign that the idea of it causing any problem at all feels almost absurd. Romaine lettuce. Romaine functions as a mild, natural diuretic, meaning it encourages the kidneys to release water. In a well-hydrated younger adult, this effect is negligible. But for a senior who is already mildly dehydrated, whose thirst signals are already weaker than they were at 40, and who may be taking prescription diuretics for blood pressure, eating a large romaine salad at dinner adds a dehydrating effect to an overnight period when fluid is not being replaced. Mildly dehydrated blood is measurably thicker and moves more sluggishly through aging arteries. Thicker blood in narrower, stiffer vessels during the overnight hours creates conditions where small clots form more readily. This is not a dramatic, immediate danger. It is a quiet, cumulative pattern that elevates risk over time. Enjoy your salads at lunch. If you prefer them at dinner, drink a full glass of water alongside your meal to offset the mild diuretic effect. This simple habit costs nothing and meaningfully reduces the overnight risk. The fourth vegetable is a snack that millions of seniors reach for daily because it feels like exactly the right kind of healthy choice: raw carrots. Carrots are genuinely excellent for eye health, immune function, and antioxidant intake. But raw carrots digest quickly, releasing their natural sugars into the bloodstream with relatively little delay. In a younger body with efficient insulin response, that sugar curve is managed smoothly. In an older body, particularly one managing prediabetes or slower metabolism, that same sugar curve can become a spike, followed by an overnight crash. When blood sugar drops during sleep, the body responds by releasing cortisol and adrenaline, stress hormones that constrict blood vessels and raise blood pressure at precisely the time when the cardiovascular system should be resting. Combined with overnight dehydration, this hormonal response creates conditions that favor clot formation in the small cerebral vessels. The fifth vegetable has been celebrated as one of nature's most powerful medicines for centuries, and that reputation is largely deserved: garlic. Garlic contains sulfur compounds that naturally thin the blood, reduce clotting, and support healthy circulation. For a healthy adult taking no anticoagulant medications, these properties are beneficial. But for seniors taking warfarin, clopidogrel, or daily aspirin, garlic's blood-thinning effect adds to the medication's effect, rather than working alongside it independently. The result can be blood that becomes dangerously thin, leaving the fragile vessels of the aging brain vulnerable to bleeding rather than clotting. Symptoms of blood that is too thin include unusual bruising, frequent nosebleeds, persistent headaches, and unexplained fatigue. These can appear gradually and be mistaken for unrelated issues. Use garlic in cooked meals in moderate amounts. Cooking reduces its blood-thinning potency while preserving much of its flavor and many of its antioxidant benefits. Avoid concentrated garlic supplements unless your physician has specifically approved them with full knowledge of your current medication list. If this conversation is giving you a new understanding of how your body responds to food after 60, I want to encourage you to subscribe to this channel right now. Every week, I bring honest, research-grounded conversations about the health topics that matter most to adults in their 60s, 70s, and beyond. One tap on that subscribe button means you will never miss what comes next. It takes 5 seconds, and may give you far more than that in return. The sixth vegetable is one of the most common flavor foundations in cooking, across virtually every cuisine in the world. Onions. Onions contain a compound called quercetin, a natural vasodilator that widens blood vessels and helps lower blood pressure. In moderate amounts, this is a genuine cardiovascular benefit. But for seniors already taking antihypertensive medications, adding significant amounts of onion, particularly raw onion, which contains higher concentrations of active quercetin, can cause blood pressure to drop lower than intended. When blood pressure drops too far, especially during the overnight hours when cerebral circulation is naturally at a lower level of activity, the brain may not receive adequate oxygen delivery. The result can be dizziness, confusion, or in vulnerable cases, a fainting episode or transient ischemic event. Use onions as a flavor component rather than a primary ingredient. Cooking reduces quercetin concentration meaningfully. Avoid heavy, onion-rich meals in the evening, and mention your regular onion consumption to your physician if you are being managed for blood pressure or circulatory conditions. The seventh vegetable is one that most people would never think to question because it feels so fundamentally wholesome and familiar. Corn. Nutritionally, corn behaves more like a starch than a vegetable. Its natural sugars convert to glucose rapidly after digestion, producing blood sugar responses similar to white bread or white rice. For seniors with slower insulin response, this rapid glucose conversion followed by an overnight drop creates the same hormonal stress response described with raw carrots. Cortisol and adrenaline rising during sleep, vessels constricting, blood thickening, and overnight stroke risk quietly increasing. Treat corn as an occasional side dish, rather than a daily staple. Eat it earlier in the day and pair it with protein or healthy fat to slow glucose absorption. Fresh corn is meaningfully better than processed corn products, which convert to sugar even more rapidly. The eighth vegetable sounds like the most elegant and health-conscious choice on any dinner menu. Asparagus. Asparagus is genuinely rich in vitamins and antioxidants, but like romaine, it functions as a natural diuretic. And for seniors who are already taking prescription diuretics for blood pressure or heart conditions, eating asparagus in the evening compounds the dehydrating effect of their medication during precisely the hours when fluid is not being replaced. The overnight dehydration and blood thickening that follows is particularly concerning for seniors because the early morning hours, when the body is at its most dehydrated after a full night without fluid, are already the highest risk window for cardiovascular events. Adding a dietary diuretic to that equation increases the burden on an already vulnerable system. Enjoy asparagus at lunch or early dinner. Drink adequate water throughout the day, and pair asparagus with hydrating foods where possible. If you are on diuretic medications, make your physician aware of how frequently asparagus appears in your diet, so they can monitor your hydration and electrolyte balance accordingly. And the final vegetable on this list is the one I saved for last, precisely because it is the most universally consumed, the most universally trusted, and the one whose connection to stroke risk in older adults is the least discussed. Tomatoes. Tomatoes are a symbol of healthy eating in virtually every culture. They are rich in lycopene, a powerful antioxidant with genuine cardiovascular benefits. But tomatoes belong to the nightshade family and contain compounds including histamines, tyramines, and solanine that in some older adults can trigger unpredictable vascular responses, causing blood vessels to constrict or dilate in ways that are difficult for an aging circulatory system to regulate smoothly. Tomatoes are also acidic, and that acidity can influence electrolyte balance, particularly calcium and magnesium levels, both of which are critical for stable nerve and muscle function. When eaten in large amounts in the evening, the combination of vascular reactivity and electrolyte disruption can produce blood pressure swings during sleep that create conditions favorable to small clot formation in cerebral vessels. Cook your tomatoes rather than eating them raw in large quantities at dinner. Cooking reduces solanine levels and actually increases the bioavailability of lycopene, making the antioxidant benefit more accessible while reducing the vascular reactivity risk. Pair tomato-based meals with magnesium-rich foods such as pumpkin seeds or dark leafy greens eaten earlier in the day. And if you have experienced unexplained dizziness, headaches, or numbness after meals containing heavy tomato sauces, mention this specifically to your physician. Let me tell you about a patient I will call Dorothy. She was 68 years old, recently retired, and by every external measure the kind of person who took her health seriously. She exercised 3 times a week, avoided processed foods, took her blood pressure medication faithfully, and cooked almost every meal at home from fresh ingredients. Dorothy came to me after her second episode of waking in the early morning hours, feeling disoriented and dizzy, with a strange heaviness in her left arm that resolved within 20 minutes. Her physician had run the standard tests. Nothing dramatic had shown up. She had been told to monitor her symptoms and follow up if they worsened. Dorothy was not satisfied with that answer. She came to me looking for something more specific. When I sat down with Dorothy and went through her daily routine in detail, her evening meals told a story that her test results had not. Almost every night, Dorothy prepared what she considered her healthiest meal of the day. A large romaine salad with raw onions, cherry tomatoes, and a garlic dressing, followed by steamed asparagus alongside her main course. She took her blood pressure medication with dinner, and she took her calcium supplement at the same time, because she had read that evening was the best time for calcium absorption. Every single item in that evening routine was something she had chosen deliberately, because she believed it was good for her. And individually, none of those foods were her enemy. But together, in the evening, combined with her medications and her calcium supplement, they were creating a pattern of overnight dehydration, blood pressure fluctuation, electrolyte disruption, and medication interaction that was quietly straining her cerebral circulation while she slept. We made several targeted changes. Moved her salad to lunchtime. Shifted her calcium supplement to the morning away from her spinach and tomatoes. Reduced her raw garlic intake and moved to cooked garlic in smaller amounts. Added a full glass of water with dinner every night. And moved her asparagus consumption to earlier in the day. 8 weeks later, Dorothy reported no further episodes of morning dizziness or arm heaviness. Her home blood pressure readings had stabilized. She looked at me during her follow-up and said something I want you to hear. She said, "I was so proud of how healthy I was eating. It never occurred to me that healthy could still be wrong for my body at this age." That is the conversation I want every person over 60 to have before they need to have it. Here is what I want you to take from this video in clear and practical terms. Review your evening meals this week and identify which of these 9 vegetables appear regularly after 6 in the evening. You do not need to eliminate them. You need to move them. Shift your highest risk vegetables to lunch or early afternoon when your body is actively hydrating, your kidneys are working efficiently, and your circulation has the full day's activity supporting it.